Hi, I'm Roger Michaud. At Franklin Templeton Investments, we believe that citizens need to be informed about the resources that can help make higher education more affordable. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of Caucus New Jersey has been provided by New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. PSE&G, committed to improving New Jersey's economy and strengthening its communities. Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. Roche, the law firm of Gibbons PC. United Water, making the planet sustainable is the best job on earth. NJ Best, New Jersey's 529 College Savings Plan. Turn a dream into a degree. And by Verizon Communications.
Hey folks, I'm Steve Adubato, and I introduce you to a very distinguished healthcare leader in the state of New Jersey and the nation. Bob Garrett, Chief Executive Officer, Hackensack University Health Network. Good to see you, Bob.
Hi, Steve. Great to see you.
Clarify a couple things. It is the 125th anniversary of Hackensack University Medical Center.
Yes, it is. I was there at the beginning. No.
By the way, help us understand this, because as you go back and understand the history, Hackensack created based on the blizzard of 1888? What does that mean?
That's correct. There was no hospital in that area in northern New Jersey at that time. So people, by and large, got their health care in New York. But one particular gentleman was seeking health care in Paterson, where there was a hospital at the time. But because of the blizzard on his way to Paterson, unfortunately, he perished. And as a result of that, Dr. David St. John, who was a prominent physician and community activist back in 1888, had the vision to form the hospital and said, you know, nobody should ever have to travel to New York or to Paterson, to anywhere else if they live in and around the Hackensack area. And he created the hospital back in 1888. Great story.
It's grown just a little bit?
Just a little bit since then, yeah.
Lots of partnerships and affiliations. And I've said this before, and Bob's been on, I'll say it again. Full disclosure, I've done a significant amount of executive and leadership coaching around communication at Hackensack. And so there are some things that I've learned about the system, and one of them is that you use a term that I want you to try to explain to folks. You said hospitals and health systems across the nation are facing what you call controlled schizophrenia.
Yes, and I'm not a psychiatrist. That's my own phraseology.
But controlled schizophrenia.
Right.
Well, what does that mean?
What it means is that right now, or traditionally, hospitals were paid for taking care of sick patients. So we had a traditional fee-for-service type of healthcare system. But now, under healthcare reform and with the creation of accountable care organizations, hospitals are also charged with keeping patients outside the hospital, keeping them healthy. So that's where the schizophrenia comes in, because we're really pursuing both strategies at the same time. If we just pursued one, we would not be financially solvent, so we have to pursue both, and they somewhat contradict each other. So that's where I say it's controlled, but it is a form of schizophrenia, because one minute you're trying to keep a patient out of the hospital, and on the other hand, you know, you're developing programs to be able to take care of sick patients. So there is that paradox going on right now.
But one of the things that struck me is the degree to which, not just your system, but other health systems that are trying to be on the cutting edge and stay in the game, right, with this changing landscape. All these partnerships and affiliations. One of them that I want you to explain to folks is the Minute Clinic in connection with CVS. What is that, and what is a hospital system doing involved in that?
Well, one thing that the general public has to understand and hospitals have to understand is that a lot of care is going to be delivered outside the hospital proper, because it's more efficient, it's more accessible, and hospitals are really going to be for the people who are very, very sick. So we formed a partnership with CVS Minute Clinic, and they run these clinics. CVS runs these clinics in their retail stores, and they're for people who need flu shots, people who have sniffles, that need basic primary type of care. We oversee the medical management of 6 clinics in 3 counties throughout northern New Jersey. And this is a model that's really out there across the country. It's somewhat new to New Jersey, but it is now coming to New Jersey. So it gives us an opportunity to oversee the medical operation. And then if a patient, many of these patients that come into these clinics don't have a doctor. They don't have a primary care doctor. So if they need follow-up care, they can then access one of the Hackensack University Health Network physicians. So it's a nice system.
It's interesting. You mentioned the primary care piece of this, Bob, in this 125th year, if you will, for Hackensack. For you or for any other leader in the healthcare industry, but particularly your hospital. By the way, clarify what Hackensack, the health network, actually includes right now, because it's not just a hospital.
Right. So it's the flagship hospital, which is Hackensack University Medical Center. It also includes Mountainside, Hackensack UMC Mountainside Hospital in Montclair, which is a 360-bed full-service community hospital. It includes Pascack Valley Hospital, which is now going to be called Hackensack UMC at Pascack Valley.
Which the state of New Jersey approved last year.
Correct. They approved last year, and we plan to open that as a 128-bed full-service hospital in June. The network also includes a clinical affiliation with Palisades Medical Center located in North Bergen, New Jersey, and we have a very close relationship with them. And also the North Shore LIJ Health System, which is located in New York and on Long Island, and we have a strategic partnership with North Shore LIJ.
So that's the context of this question. With that network, 125th year, 2014, January, the implementation, if you will, of so-called Obamacare.
Mm-hmm.
2 biggest challenges you would say you face.
One would be as a system, getting back to that controlled schizophrenia, is being able to manage multiple hospitals and make sure that we continue to take care of sick patients, but also making sure that we align with physicians, align with the community to make sure the population stays healthy and well. So that's a really big challenge, because that's something new for hospital administrators. You know, we traditionally run hospitals, but we really haven't been charged with making sure that the population stays healthy. And one of the ways we're going to do that is, speaking of 2014, we're going to be opening up a comprehensive wellness center in Bergen County.
A wellness center.
A wellness center. So it'll include fitness. It'll be state-of-the-art fitness, as well as wellness types of programs like diabetes education. There'll be mammography screening. There'll be community educational programs to help people stay healthy, to eat well, to exercise. So there's a whole wellness component to our mission moving forward.
Bob, with all the economic challenges you face, with the reimbursement issues being what they are, you and your colleagues, we've had many of your colleagues talk about that so much. How are you then expanding and doing something like that? Well, given the economic challenges you face, because that costs.
Absolutely. Because of those economic challenges, hospitals and health systems have to diversify. There's going to be less revenues coming into the hospital business per se. So we then need to get into wellness types of initiatives. We need to partner with the likes of CVS to run these clinics.
You have to do those things.
You have to, because if you're going to maintain yourself financially as a viable organization, and you're going to have, say, 30% less revenues on the hospital side, you have to be able to diversify and really think about other business lines, if you will, other ways that healthcare is going to be delivered.
And finally, if a system doesn't do those things, they're vulnerable to what?
Very vulnerable, because the hospital portion of a system's revenue will continue to decrease and decrease and decrease.
That's the economics.
It's just the economics. It's a way that things are rolling from the natural market forces and from healthcare reform.
Bob Garrett, CEO, Hackensack University Health Network, 125 years. Yes. You were not there at the beginning, Bob
Thank you for saying that.
Thanks for joining us. We appreciate it.
It was great. Thank you.
Stay with us. We'll be back right after this. You were not there.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at caucusnj.org, or find us on Facebook at facebook.com/Steve Adubato, PhD.
Monique King-Viehland is the president of Campus Gateway Development, Inc., connected with NJIT, New Jersey Institute of Technology. Good to see you, Monique.
Thank you. Good to see you as well.
This is a fascinating initiative. Put this in context for us. The Campus Gateway Development project, 10 years,
10
$1.3
years.
billion.
Yes.
Where is it? And because we're seeing in a lot of different states, but even for folks in New Jersey, NJIT is a very important academic institution in Newark.
Yes.
And this project is an economic development project. Where?
It's in the University Heights section of Newark, and it's actually one of the sections where there are a lot of different colleges and universities. So we have Rutgers, we have NJIT, we have Essex County, we have UMDNJ, and what we're trying to do is an initiative that builds on the momentum and the assets of that 40,000 plus people coming into the city every day.
Now someone might say, okay, why would the New Jersey Institute of Technology, why would an academic institution of higher learning get involved in business, economic development? Why is that your business?
You know, it's our business because we're a neighbor. We live in that community. We're in that community. We've been there since 1881, and we'll continue to be there. You know, anchor institutions like NJIT aren't going anywhere. So our focus and our future and Newark's future is all linked together. And so it's important for us to make sure that we're doing as much as we can and taking a proactive role to continue to see the city redevelop.
Monique, let's break it down a little bit. We talked to your president, Dr. Bloom, who's been advocating this project, and his predecessor, Bob Altkirk, did the same thing. So now let's put it in perspective. 4 phases, right? We got 4 phases.
Correct.
Jackie Cook, our producer, we got some pictures of this, Jackie? We're going to, as we show some pictures of phase 1, under construction right now. This is the Warren Street Village, correct?
Yes.
Talk it through.
So this is the Warren Street Village. The view you're seeing is the perspective of a rendering from Raymond Boulevard. Warren Street Village is an $80 million project. It's on approximately 3 acres and it's 214,000 square feet. The building in the far back is the Dorman Residential Honors College building.
The Residential Honors College, 6 stories.
6-story building, 4 floors of residential living, 1 story of office, and the bottom has dining facilities, fitness center, and a convenience store.
Why is it so important to have such a facility? By the way, what are we looking at right there?
This is actually the project last week under construction.
For real?
So yes, it's going up pretty fast.
Wow. That's wild.
Yeah.
By the way, very tough to get financing for this, no?
That's correct. Yeah, we tried to pursue the Urban Hub Tax Credit Program at EDA. You know, clearly that program was oversubscribed, and then EDA sort of went into a moratorium.
Economic Development Authority?
Economic Development Authority went into a moratorium. And actually, I was impressed. What our board ended up doing was deciding that this project was too important as the first phase of Gateway and too important to stop. And so we actually went out and did tax-exempt bond financing for the project.
Talk about commitment.
Exactly.
That's a real commitment.
Exactly.
And you know, as we talk about phase 2, which is planned for spring 2014, what's interesting to me is this is huge in terms of, I mean, growing up in that neighborhood, knowing Newark very well, NJIT, very smart students, you know, premier academic institution. But being connected to the neighborhood wasn't always the thing. You know, there was always some, they're not really part of the neighborhood in the way you're talking about right now. That's a big part of this.
That's right. Phase 2, I think, was most interesting, and it excites me even more than phase 1, because phase 2 is really the first phase where you'll see the boundaries between campus and the community dissipate.
What do you mean?
Phase 2 is all about creating a better space, not just for the students and faculty and staff at NJIT, but also for the residents of the University Heights community. It's going to be a mixed-use development. It's not focused on student housing. It's hopefully going to have a grocery store.
Hold on, let's talk about it. A grocery store. Why,
Yes.
for folks who don't know this section of Newark, why is having a grocery store such a big deal?
You know, well, 2 reasons. One, we know that for a long time Newark has been a food desert. And although we are starting to see some retail come in terms of grocery stores, we still are underserved and could use more grocery stores. The other thing is we did a large-scale surveying process of the community before we started this to look at what they needed, and one thing that came back as a resounding yes was that they needed a grocery store in the community. So we know this isn't just going to serve NJIT people, this is going to serve the larger University Heights community, and I just think that that's tremendous.
The other thing that's so interesting here is retail stores. This is all in phase 2, folks. Retail stores, more housing,
Yes, more housing, non-student housing.
Oh,
so this is
non-student
not
housing.
affiliated housing. We are not building NJIT student housing. We are looking to have the private developer build non-affiliated housing that hopefully will attract some young professionals to the area.
And why is a parking garage so important?
Parking garage is critical. We lost some parking when we did phase 1 for NJIT, and also phase 2 is on a lot that's currently utilized by St. Michael's Medical Center.
Right.
So we're replacing both of those parking and providing parking for the retail.
Now, we were talking about this before we got on the air. You grew up and know Trenton very well.
That's right.
And I actually grew up just a couple blocks away from where you are right now at NJIT. Places like Newark and Trenton, right? But in this case, Newark in particular. Why is it so important that, I mean, this is referred to as University Heights. You know, you got Rutgers Newark there, you have NJIT, you have Essex County College, right? Why is it so important that academic institutions like NJIT take a leadership role here in the community?
I think it's important because we're here. And we're going to be here. We're not leaving. We're not going to relocate our corporate headquarters. I mean, Newark is our home, and it's important that we want our home to be the best that it can be. And we understand that the relationship between us and Newark's success is one that's synergistic. So if we want to continue to grow, we want to continue to be successful as a premier technological university, we also need to make sure that Newark continues to grow and be successful as a city.
And the reaction you've gotten so far has been?
It's been very positive. We've gotten very positive reaction from the city, from the community, and from the students and faculty of NJIT.
You know, it's so interesting. Folks who, this is part of the quote-unquote Central Ward in the city of Newark, which was ravaged by the riots in 1967, which, you know, for those of us who were little kids at the time, remember, you never forget that. This has the potential to bring folks from the Central Ward who've been there a long time and NJIT closer together, no?
I agree, yes. And I think the process that we undertook is central to that. I mean, we started this back in 2006, and it was a long community development process. So we're doing this with our stakeholders. This isn't a project that's happening to University Heights, it's a project that's happening with the University Heights neighborhood.
18 months, come back and give us a progress report, Monique.
Will do.
Congratulations, keep it up.
Thank you.
To our partners at NJIT, thank you. I'm Steve Adubato, stay with us, we'll be right back right after this.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at caucusnj.org, or find us on Facebook at facebook.com/Steve Adubato, PhD.
There he is, Michael Tozzoli, Chief Executive Officer, West Bergen Mental Health Care. Good to see you.
Nice to see you, Steve.
Tell us what exactly your organization is and does.
Sure. West Bergen has been in existence exactly 50 years this month, actually. Community mental health center that started with a handful of people coming together to put a mental health center together. 50 years later, we employ 250 people, and this year we'll touch just about 4,000 lives.
You know, some of the areas I want to focus on, we're doing this program in mid-February 2013. You know, the horrific shooting in Connecticut will play on our minds forever.
Indeed.
But the issue of youth depression, the issue of mental health for young people, it's a big area for your organization.
It is.
Why don't we know more, and why haven't we done more for young people suffering from mental illness?
It's a great question, and just as I said a minute ago that we touched 4,000 lives, I'm very proud of that number. Having said that, that number should be 8, 12, 16, 20,000 lives. We are really just touching the very top of the cake. Very little in terms of education, very little in terms of people coming in. And the statistics are clear. People come in, only 1 in 4 that need treatment will actually walk through our threshold.
But in terms of children, are more children suffering from mental illness, depression, than we realize?
Without question. Suicide is the second leading cause of death for kids 14 to age 23. Accidents is the only thing that kills children more. It's more than disease, it's more than all the other diseases actually put
Michael,
together.
why aren't we picking it up?
Schools, I think, have been slow to the table. I think that in the last 4 to 5 years that has changed significantly. I think we as a field have been slower to actually get out there and educate parents. I think we're...
Excuse me, educate them to do what? To look for what?
To come and talk to us. I always say this, small fires are much easier to put out than big fires. So if your kid is not doing well, sleeping too much, not sleeping enough, really not doing well from an emotional perspective, think about bringing them into West Bergen or any of the other wonderful resources that are out there. Small fires are much easier to put out than big fires.
Signs. Again, by the way, log on to the website you see on the screen right now. We're here to be a resource for the community. Your kid is saying that he or she is being picked on at school consistently. Sign?
Without question. Of potential depression, potential anxiety. Risk is very high with bullying. And it's not just the playground. It's no longer just the playground and the school cafeteria. It's the computer, it's texting.
Cyberbullying?
Cyberbullying is a big issue and getting bigger, by the way, much bigger.
Well, what's the correlation then between cyberbullying or any sort of bullying and mental health issues?
Big correlation. If you're a child that is being systematically, repeatedly told that you're worthless, if you are a child that's repeatedly being picked on in whatever way, you're much more likely to be depressed, to be anxious, and to think about doing something that's more drastic.
That's true.
Without
I
question.
have a sip of water.
Yeah, sure.
I'm thinking about this. Asperger's. I hear people talk about Asperger's a lot, and I know that your organization is very helpful in terms of Asperger's services. What is Asperger's, and why do so many people not know what it is or misunderstand what it is?
Asperger's is part of the autistic spectrum disorder. So autism, big topic you hear a lot about in the last probably 2 to 3 years. If you think about a bell curve, on the one end of the bell curve is the classic Rain Man, no language, really severe autism. All the way at the other end of the spectrum is Asperger's syndrome. Those are clients that have autistic-like disorders. The most prevalent part of the issue there is that they don't get normal social interaction. So they don't get verbal social cues, nonverbal social cues. We communicate with each other about 80%, the data tells us, using nonverbal cues. They don't get that. It doesn't come naturally to them. It's likely that that part of the brain didn't develop. We don't really know that for sure and probably won't for a while.
And your organization helps.
We do.
In that area.
We are the largest provider in the tri-state area of mental health services for people with Asperger's. We do it in a number of ways. The largest way that we do it is through social skills groups. In any one group at West Bergen, we're doing 40 groups full of kids, full of adults with no replication.
Let's talk about coverage here. Because it actually, you were referred to us by some folks that we talked to over at Horizon. So I'm curious about this. A lot of people, I've actually heard people say that they would love to access mental health help. I'm not covered for that. Imagine that discussion. Like mental health is like if they had cancer, well, I'm not going to get. But they go, that's not the same as cancer. Oh, it's not, but
the stakes are high, Steve. The stakes are real and the stakes are high.
Let's talk about, I mean, again, everyone has their own coverage. But
coverage can be inadequate. What we're seeing with the current insurance environment is that insurance companies are really pulling back, although they shouldn't under the law. In effect, they are. And treatment just is harder for them to access. Come into West Bergen, certainly we would utilize your insurance, but most people that come into West Bergen have some type of sliding scale, some type of reduced amount of fee so that you can stay as long as you need to stay. Because typically an insurance company will dictate a certain number of sessions. 20 is a very typical model. Imagine an oncologist being told, the breast cancer is bad, your patient can see you 10 times and only 10 times. On the mental health side, it's really a fallout from stigma, actually.
And you know, it's interesting, in the minute we have left, we actually talked to Governor Christie about this in an interview we did, and I'm sure hopefully a lot of folks saw it from New Jersey Performing Arts Center. And he actually talked about this piece. He said the stigma. He said, how dare we treat it differently than cancer? That's what made me think about that. And if we don't deal with it, real quick, 30 seconds left, what are the consequences?
Stigma. Without dealing with it, suicide rates will increase. They will get worse. Depression, much worse. Kids that have emotional and mental illness have a 50% dropout rate.
Are they potentially more violent? I mean, could they potentially be? I don't want to be an alarmist, but
we don't want to tie those two together. But know that all the issues that we've been seeing, Connecticut, beyond that, the one thing that is consistent across the board is that mental health treatment would have helped without question, without any doubt.
Michael Tozzoli, Chief Executive Officer, West Bergen Mental Health Care. Your organization is doing important work. Please keep it up. Thank you, Michael.
Steve, thank you so much.
Thanks for watching. Now let's continue the conversation about this and other important topics and issues on Facebook. Visit my page at facebook.com/Tozzoli. Steve Adubato, PhD.
The preceding program has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. And 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus, New Jersey has been provided by New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. PSE&G, committed to improving New Jersey's economy and strengthening its communities. Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. Roche, the law firm of Gibbons PC. United Water, making the planet sustainable is the best job on earth. NJ Best, New Jersey's 529 College Savings Plan. Turn a dream into a degree. And by Verizon Communications. Promotional support provided by NJ Biz, All Business, All New Jersey. The Star Ledger and NJ.com, Everything Jersey. And by New Jersey Monthly, the magazine of the Garden State, available at newsstands. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus, New Jersey has been produced in partnership with TriStar Studios.
New Jersey Manufacturers Insurance Company offers policies that can protect against auto accidents, fires, windstorms, floods, and many other serious and urgent situations. Tips on what to do before, during, and after you're confronted with the unexpected are on the emergency preparedness section of njm.com. New Jersey Manufacturers, helping the Garden State prepare for the unexpected for nearly a century.